Did you know, my friends, that California has been stealing what looks like close to $1 billion a year for Medicaid, for non-citizens, for criminals, for the scum and villainy of infestation that has been haunting our country for the last 30 to 40 years? California is helping that stay a reality by giving money to non-citizens who are all criminals who need to be kicked the hell out of the country. This is from Fox News. Key Trump agency is vowing to claw back over $1 billion. It's actually $1.3 billion, benefiting non-citizens in blue states, and will not tolerate it. Federal audit finds California is the main culprit, using federal dollars for illegal immigrant health care. The Trump administration is planning to claw back over $1 billion in federal Medicaid dollars it says are being spent by blue states on health care for illegal immigrants, including some with violent criminal records for murder and rape. That's extra bad that they're, violent criminals, but who the hell cares? Every last one of these people is a criminal, man, woman, and child. The children are less guilty, of course, but when they become adults, they need to be kicked the hell out. You cannot tolerate this. And we have tolerated the illegal infestation for way too long. Now, a preliminary audit by the Centers for Medicare and Medicaid Services found that over the last few years, mostly during 2024 and 2025, California, Washington, D.C., Illinois, Washington, Colorado, and Oregon illegally spent a combined $1.3 billion in federal Medicaid funds to help pay for non-citizens to get health care. While federal Medicaid dollars are supposed to be prohibited broadly from being used to cover health care for illegal aliens, they can be used by states for emergency treatment regardless of a patient's citizenship or immigration status. States can also illegally cover health insurance for illegal immigrants as long as it is only done with state dollars, which is bullshit because that's always going to be, state dollars are always infused with federal cash. Here we go. Yeah, and according to some experts, Democrats are utilizing loopholes in the federal laws that allow them to provide comprehensive health benefits to non-citizens. Protecting Medicaid from waste, fraud, and abuse isn't optional. It is the law. Every dollar misspent on illegal health care spending is a dollar taken from vulnerable Americans. Damn right it is. Federal law forbids using Medicaid funds for illegal immigrants, yet several Democrat-led states did it anyway, and there needs to be hell to pay. Honestly, somewhere down the road, there needs to be criminal liability for this kind of crap. States need to pay a price for aiding and abetting criminals. And I don't just mean the ones that come here and enact additional crimes after breaking and entering into the country. They're also they're committing crimes by being here. And every day that they stay here is another crime in my book. Because you're continuing to put the middle finger on the American people and say, we don't care, we are going to continue to break the law, and la-di-da, you can't do nothing about it. Now, the Trump administration is not going to tolerate this. CMS is auditing aggressively, recovering every dollar and holding states accountable. That's not enough. You can't just try to claw the dollars back. That's a step in the right direction, but you need to come out there with a giant sledgehammer and start beating down the doors here. Now, California was far and away the biggest culprit, spending over $1 billion in federal Medicaid dollars on healthcare for illegals, according to CMS. The next largest violator was Illinois, which CMS said has improperly spent nearly $30 million, followed by Oregon, which the audit found improperly spent approximately $5.5 million. California Governor Gavin Newsom's office is denying the claims that the state is improperly using federal funds to pay for illegal immigrant health care because they're a bunch of liars. And they told the Los Angeles Times that these claims from Republicans are false. But of course, they would say that no matter what because they're trying to do a little CYA. But Steve Hilton, a former Fox News anchor and current Republican candidate running to be the next governor of California with Newsom term limited, has argued that California has been using a complex Medicaid provision known as a provider tax to obtain matching federal dollars. So federal money is absolutely being spent here. Which then gets pooled into the money used by the state to pay for its health care offered to undocumented immigrants. Chris Pope, meanwhile, a public health policy expert at the Manhattan Institute, has argued that California is abusing federal provisions, which of course they are, that allow states to use federal Medicaid dollars for emergency care for undocumented. That should also be abolished. Screw these people. I'm sorry, and I know it sounds cold to say it, but they get nothing. Straight to jail. You know what? I'm okay with them getting emergency medical health care as long as they are immediately arrested after that. That they leave the hospital in handcuffs. Fine. Then you get your emergency health care. Otherwise, F you. You don't get to be here and steal from us. The Fox News Digital reached out to Newsom's office for comment on the story, but of course they did not receive a response. Pope went on to say that Medicaid is by far the largest source of federal funding for states. It was originally intended to provide only aid for eligible beneficiaries, but over time states have figured out how to game the system, padding permitted expenses and diverting the profits to fund activities which are supposedly prohibited. Honestly, a lot of this stuff needs to get clawed back and reduced. Any claim that state healthcare expenditures do not ultimately involve some form of federal funds should be regarded with suspicion, meaning it's a bunch of BS. Jim O'Neill, the current acting director of the Centers for Disease Control and Prevention and a deputy secretary at the Health and Human Services Department, has also been highlighting that among the federal funds that are improperly going to illegals, some are even going to illegal immigrants with violent criminal pasts. Honestly, I don't care. They're all criminals. Every last one of them. Just because they commit additional crimes doesn't excuse them. O'Neill has been posting a daily morning Medicaid mugshot with examples over the last several days. On October 29th, O'Neill highlighted Laith Camille, a 24-year-old illegal from Iraq convicted of exposing himself to a 15-year-old. That just seems par for the course considering where he comes from, who, according to O'Neill, has received close to $16,000 in taxpayer-funded health care. And the day before that, he highlighted the story of Hassim Masalki, a 45-year-old illegal alien, again from one of those shithole countries, Lebanon, convicted after driving under the influence and killing an American citizen who was out jogging. He has received over $30,000 in healthcare benefits. Other illegal aliens included people convicted of attempted murder and child diddling. Democrats are demanding continued funding of this violent illegal aliens Medicaid as a condition for reopening the government and paying the hardworking public servants at my department. Yeah, all of this is crap. And at some point, there needs to be a criminal punishment for this. You are aiding and abetting criminals. Illegal aliens. It should be treasonous to be helping them stay in this country. But that's just me. That's what I think. I'm just some guy on the internet, so what do I know?